This week, HHS Secretary Robert F. Kennedy Jr. announced the CDC would eliminate guidelines that recommend healthy kids and pregnant women get the COVID vaccine. But it's still unclear how a person can get one if they want.
Yeah, until now, the U.S. has followed guidance from independent experts who advise the CDC and recommended yearly COVID shots for everyone 6 months and older.
That's right. Joining us now to talk about what you should know, Professor of Population Health Sciences at UW, Ajay Sethi. Thank you so much for joining us.
Yeah, thank you.
So how will people be able to get shots for their children, and will insurance be an issue?
Yeah, there are going to be barriers. People who have been used to getting shots every year are going to have a harder time figuring out where to get it this coming fall. Insurance doesn't have to be a barrier. Insurance companies can certainly cover the boosters for people in their plan, because that's what doctors and health systems would want them to do. The science shows that the vaccines are safe and effective, and anybody over 6 months should get them.
Yeah, and to expand on that, I have to wonder, with a little more uncertainty on this now, so who will be able to get the vaccines in the fall?
Yeah, so by excluding people who are so supposedly healthy, we're making this assumption that everybody knows whether they're healthy or not. And we know in this country, a lot of people have high blood pressure, prediabetes, diabetes, other underlying conditions that they're not aware of. And if you think you were healthy 5 years ago when COVID first, emerged, 5 years later, we tend to get less healthy over time. So the problem with saying that healthy people don't need to get the vaccine, it just makes a big assumption that everybody knows what their underlying risk is. Well, making the recommendation for everybody is a better idea.
And you are an expert in population health sciences. So what does this mean for the greater ability for the country to fight COVID, in your opinion?
Yeah, so already it's a hard sell to get people to get the boosters every year. Now it's going to be even harder. It's going to lead to more hospitalizations with fewer people getting boosted, but hopefully those who are at higher risk, those who are older, will continue to get them. And hopefully at the level of the clinics, in the community, we can still get the message out that people should find ways to get the booster.
I'm curious, why do you think HHS Secretary Kennedy made this announcement?
Well, there's been sort of a years-long, actually much longer than that, effort to just get the federal government to divest from recommending vaccines in general. COVID boosters are kind of low-hanging fruit because a lot of people are still polarized because of the pandemic. And, there's just a lot of false rhetoric out there about the safety of COVID boosters. They're safe. RNA vaccines are safe. They're a revolution. They led to people getting the Nobel Prize for them. And there's just been this effort by leadership today to undermine vaccines, which is very unfortunate.
You mentioned, when we asked who could get it, that people who are immunocompromised and then the elderly. What age population or range is that for people who are watching?
Yeah, so people who get hospitalized for COVID right now tend to be 65, actually 75 and older. And anybody younger than that is still at risk when you have those underlying conditions. So it's a good idea to check in with your doctor to just get a health checkup and see what they would recommend as far as getting boosted.
Professor Sethi, thank you for being on with us today.
Thank you so much.
Thank you for having me.